I want to welcome everybody this evening. Thanks for coming out to the community meeting on healthcare. My name is Scott Whittick, and I'm with Wichita State University. And we were asked by the City of Independence and the United Methodist Health Ministry Fund to come and support a series of conversations about healthcare and healthcare access here in Independence. And for those of you who don't know, the United Methodist Health Ministry Fund is a foundation committed to health and healthcare access here in Kansas. And several of their staff are here. Kim, Katie, Aaron, you want to wave a little bit? Let people recognize Aaron's in the back. Thanks for supporting these meetings. Some of you may know Kim from way back when. I understand there may be some stories in the crowd from when he was growing up, so we'll get to hear those later in the evening. So Kim is from around these parts, so thanks for hosting this. Our purposes for this evening are very important, so we're excited with the size of group that we have. Our purposes, first and foremost, is to listen to you about healthcare and healthcare access in this community. And there's a lot of people to listen to. And so this evening, we're going to be giving some instructions about how we can listen to as many people as possible about your experiences around healthcare and healthcare access. Second, we want to explore options. What could we do? That's a powerful question. What could we do? And so a second set of questions will revolve around what could we do as a community around our healthcare needs and healthcare gaps. And then finally, we want to make sure no decisions will be made tonight, nor no decisions have already been made. So while we'll answer that question, what could we do, we won't decide tonight what should we do. We want to get options on the table. And as I mentioned, several staff and myself from Wichita State University will be facilitating those discussions. Some of the time we'll be in a large group. Some of the time will be broken out to some of the other meeting rooms that are a part of this facility. And so we'll be both in small groups and as a large group. A few other logistics to keep in mind. First of all, if you have a cell phone, if you would mind placing it on vibrate or manner mode. If you do have to take an emergency call or a call for any reason, if you don't mind stepping out to take those calls. Restrooms are straight down this hall and around the corner to your right. Also, help yourself to any of the refreshments. Also, be comfortable. If you feel like you need to stand up and walk around a little bit during the meeting, any time like that, feel free to do so. Make yourself comfortable this evening. Also, one other logistical item. You'll notice at your tables there are several sign-in sheets. If you would, at some point this evening, sign in. There's contact information available for you to sign in, telephone, email, address. That's so that additional communication can be provided from beyond today. So we'll be collecting all the responses from today, and a report will be generated from that, and additional steps and conversations to be had. And so if you want to be contacted for those opportunities, be sure to sign in. I'm looking around the room to other staff from Wichita State University if I'm forgetting any initial announcements before I turn it over to Mickey Webb from the City of Independence for some initial comments. If not, again, thank you for attending. I'm going to turn it over to Mickey, who has some initial comments to share.
Yes, this process is happening because your commission wanted to hear from you tonight, and this is technically a city commission meeting. It's a workshop. Like he said, there's not going to be any decisions, but I would like to recognize our city commissioners. Mayor Leonard Kaflish, could you stand, Mayor? Thank you. And our Commissioner Fred Meyer. and Commissioner Gary Hogsett. Again, they will be here, as I will, but we'd ask that you don't try to put them on the spot because they can't make any decisions tonight. It would be a problem. But the purpose of this is to hear you. I'd also like to thank the United Methodist Health Ministry Fund and the Kansas Health Foundation for providing the financial support for this process, and also for Fastenal, Aaron Rental, and the Chamber of Commerce for the water and the cookies. I think that we had a couple of sessions this afternoon that were individuals that were picked by myself, and everyone here will get that same opportunity to meet and express your opinion, the same as they did this afternoon. So with that, I'll turn it over to the professionals. Again, I thank you very much for your attendance and for your time, and I think that it will be well spent.
Good evening. My name is Seth. I'm part of the Wichita State University crew. The Community Engagement Institute at Wichita State does a lot of things, and one of the things that we do is to help communities and organizations have conversations. And we have some ideas tonight about how to do that so we can hear from as many of you as possible. But I want to say first thing, this is not the only conversation that will be taking place. So there will be additional opportunities, and there will also be a survey going out to the community so that we can hear from even more people. So I'm asking you to balance. We only have 2 hours tonight. We want to hear from as many of you as possible in your words, the things that are really important to you. And also, we'd invite you to trust the process that this isn't the only time to have your voice heard. My job tonight is to give a lot of instructions, and we know there will be some chaotic moments, so I'll take the blame for those now, but I think we've got this lined out so that we can do the most good. We're going to have our conversation tonight kind of in 2 parts. We're going to first have a conversation in which we're going to ask you to divide up just by the label that's at your table. And so I'm assuming you put a lot of thought into the color of the table that you sat down at. I'm assuming all the people at the yellow table are looking forward to the Wichita State game tonight. There are a few of those. But for the first section, we're going to ask you to go in that semi-random way just according to your color. And there will be some groups meeting in here at the same time, which could be a little chaotic, so we'll ask you to extend one another some grace. And there will also be some groups meeting, one in a room off this direction, one in a room off this direction, and one in the lobby area upstairs in front of the auditorium. So we'll have those color-coded. Anything else from my colleagues before I start getting to tell people where to go? I did tell the logistics group that met earlier, from my point of view, tonight is already a success. I live in Winfield, and back home tonight is church choir practice night, and my mother-in-law is also my choir director, and I have a good reason not to be at practice tonight. So thank you all for that. For this first conversation, we're just asking you to go according to your color. So if your group is blue, you're going to go with Sarah, and you're going to go out the door. Is that correct? So if you are at a blue table, you'll follow Sarah out the door this direction. If you are at a purple table, you will be with Scott, who was up here earlier, and you will be gathering around that corner of this large meeting room. If you are at a yellow table, you will be with Judy, and you'll be upstairs in the lobby area in front of the auditorium, and you can get there by the stairs or by the elevator. If you are at a table that is red, you will be with Amy, and you'll be in the room that's just over this direction, down the hallway. If your group is orange, you're stuck with me, but you'll also have Lindsay, and we'll be back in that corner. And if you're at a table that is green, you'll be up in this front corner with Kim. What's important is that by 6:25, everybody is back here in the large group to provide a little bit of update before we do our next division. Are there any questions about your instructions? All right, follow your color and have a really good conversation. Thank you for this first round of conversations. I know that Lindsay and I really appreciated hearing from our group and their high level of engagement. We're going to share some of those top concerns or maybe concerns you thought your group had that others might not voice before we move into the next kind of our set of our conversations. And so first, Sarah, what were some of those from the blue group?
All right, so the top three that we decided to bring back from the blue group are around, so again, these are concerns that folks have about healthcare access in the independence community. First concern is, what do we do about emergencies? So that was the first concern. The second is around continuity of care, so being able to receive services and have someone know all of the things about you as an individual patient, so continuity of care, and also having some stability in physicians that are in the community over time. And then the third major concern was around economic impact and economic stability as a result of the hospital closing, so the economic impact that has on the community.
Hi, Scott Whittick again. I was with the purple group back in the back corner. Some similarities here. We grouped our concerns in immediate issues or immediate concerns. So if something happens to me, confusion or uncertainty about where to go, will my insurance, am I covered? So uncertainty or being unclear about where I go. Also immediate issues around transportation. If I'm taken to the hospital in the ambulance, how do I get home from that? Or if I have an appointment, how do I get there if I lack transportation? So immediate issues. There was also concerns about some of the long-term implications, as Sarah mentioned. How will this impact our economy in general, the population, businesses wanting to locate here, and kind of that ripple effect that it could have on our entire community?
This one's a little shorter. We had two things that really stood out, and they've been addressed before, but it was about EMS services. The question was, what can EMS people, or what are they trained to do? What decisions can they make? If I need to be airlifted, can they make that decision? The perception might be that these people are not doctors, so they can't make those decisions, which delays care for whatever your condition is. But they say that they have been trained to make those decisions, so we need to communicate that to the people. Because they're not doctors doesn't mean they're not qualified to do what they need to do at that point in time. And we heard some really good stories about EMS services, and they were very positive comments. So it's not that they're negative about it. The community just needs to know better. The second thing was, what can we expect in our community? The question was, I had the same doctor for the first 20 years of my life. Can I expect that now? We seem to be kind of a stepping stone for young doctors to move on to someplace else. Can we change that and encourage them to stay? Or is telemedicine changing the landscape of what medicine does today? Those were some of the issues. Can we expect a hospital if we're within or less than 30 minutes of several other hospitals? And then the big question was, what can we learn from other hospitals in communities this size that have been through a similar problem? What can we learn from others that have worked their way through this?
Hi, everyone. My name is Amy, and I worked with the red group today, so we used a green marker. But this is going to sound pretty familiar. Our two main themes were fragmented and economics. So there's a sense that healthcare in this community now feels fragmented because there are lots of different providers, and we don't really understand yet who's available when and where to go and what services they're providing. And then similarly to a previous group, for the individual, the system feels fragmented. Who is in charge of my care and looking out for me throughout my lifespan? In terms of economics, there are a few issues. There's concerns about the business impact, the ability of this community to attract and retain businesses, both new ones coming in and ones that are here currently. And then questions about whose responsibility is it to support healthcare in this community, and who has the political will. Do the residents of Independence have the political will to support financially through a sales tax or other form of public support, or is it a county's job to do more regional approach to supporting healthcare, and would they do it, or is there some other person or entity that's responsible for that? And we also wanted to recognize that an economic issue here is for folks who don't have access to transportation, with the closest ER facility being about 20 minutes away. That increases the stake of decision to call an ambulance service if you'll need to be the one paying for that bill later. And also, if you're not don't have access to a car, maybe you'll choose not to get your emergency care taken addressed. So those were some of the issues from the red group.
The orange group included in our answers some things we thought maybe we talked about that wouldn't have been heard in other places, as well as things that were concerns. So one of the things that we heard is for people who might need to start accessing care in other communities, in those communities, they might not know what resources are available to them or how to find them. And also, they might experience that feeling of, I don't belong here, or I'm not connected here, or I feel displaced here. And we talked quite a bit about that. Our group identified the long history of the hospital auxiliary, and the good work that it's done over time, and the loss of that group, and what that's like for those individuals who've been dedicated to it, but also that loss of volunteer power in the community is something that's a concern. Our group talked also about poverty, about people who have low access or no access to transportation, and also about people who have low literacy or experience illiteracy, that in combination with needing to seek care elsewhere is a difficult combination as they're trying to find places to go and navigate those other systems. And our group also talked about economic impacts and what this might mean for retaining and attracting employers to the community. And for the green group?
Well, these WSU facilitators were just better at taking 6 or 7 ideas and acting like they described 2 or 3 to you. But I just wrote 5, so just to be honest. Our group listed a lot of particular services: diagnostic, emergency, prevention, outpatient surgeries, and said they are concerned about how these are going to be delivered without having a full hospital. And then they said there really is a need for 24-hour urgent care, whether there's a hospital or not. And then one thing that sort of piggybacks onto what Seth said is about health insurance coverage, that we really have to work to find a community solution to get people covered, be sure they have good information, and make sure that coverage, we use the word portability finally, that a lot of people are struggling with the coverage being out of state, out of county, out of network, out of whatever, and that there's a lot of room for, I would call it health insurance literacy, but helping people understand what their coverage. We also said transportation and physicians. Thank you.
You did a really good job of engaging in that first round of conversations, and you were really good sports for those of you who had to navigate being in some spaces where other people were talking. Thank you for continuing to participate. I get to order you around again. And this time, instead of using the color of your table to decide where to go, we'd like to give you some options for the conversation that you'd most like to have. And so we have some categories to read for you, and we'd ask you to think about which one best reflects how you describe yourself or your concern or interest about this issue. So I'm going to read the categories first, and then I'll go back through them and tell them where to go if that's the group you'd like to be part of. So one category is for senior adults, and we'll have a group talking about that. One category is for families with children under 18, and so we'll have a group talking about that. One group is for folks who have had problems with health care insurance eligibility, or for folks who have had trouble with health care affordability, and that might have been even before the hospital closure that we're talking about now. One group will be for people who consider yourselves part of the education field or community in this area. One group will be for people who have aging parents or relatives, and one group will be for people who identify with the healthcare field in your community. And I know those categories might not normally fit together, but as we planned this meeting, those seem to be ones that stood out as important. So for tonight, choose one of those that you could go to and have a pretty good conversation. If you happen to get to that area and there's just not a seat, you can make a judgment call about whether you want to fight your way in or choose your second favorite. Either one's okay. We'll do our best to accommodate that. So I'm going to go back through the list and tell you where you will go if you want to have one of those conversations. So if you want to be part of the senior adults conversation, you'll go back with Scott to the purple area here in this room. If you want to be part of the group having the families with children under 18 conversation, you'll go to the blue room with Sarah. If you want to be part of the conversation for folks who have had trouble being eligible for health insurance or folks who have had trouble affording health care, you'll want to go to the red group with Amy and Lindsay, and the red group is out there somewhere. If you want to be part of the conversation representing the education field, you'll go with Judy to the yellow group. That's the group that meets upstairs in the lobby area in front of the auditorium. If you want to be part of the group that is talking about having aging relatives or parents, you'll want to go with the orange group back there with Aaron. And if you want to be part of the conversation for people who represent the healthcare world in this community, you'll want to come over here to the green group with Kim and Katie. Now, in your first conversation, my guess is you had time for a pretty leisurely, thoughtful conversation. That was then. This time's going to be a little different. This one's going to be a little bit more about clicking through the questions and hearing from as many people as possible. So if you were doing a lot of storytelling in the first conversation, this is the time to dial back the stories and really get the data down. Are there any questions about the instructions? All right, go have some really good conversations. The way we'll close this out, we're going to hear briefly from Mickey about some of the process going forward, and I'll come back and provide you my informal, in-the-moment summary of some of the things I've heard. And then, of course, there will be future options for conversation as well as for the survey.
Yeah, again, I'd like to thank everybody for spending your time here. I think it's going to be well spent, and I think it's going to be invaluable to the city and our community leaders. This is not just a shot thing tonight. We're going to have another meeting later, and I hope it's a part of a process that starts that we can all work together for improving health care in our community. And along the line, we've heard a lot about getting information out. Separate and apart from the city's effort, we've got one of our health care providers that would like to make an announcement now. Mr. Pinkerton?
Well, it's good to see everybody out here this evening, and we all have the commonality of health care. It's a big issue. So I want to say thank you to everybody for coming out, but also would like to invite each and every one of you and to spread the word also. Monday evening here at 5:30, from 5:30 to 6:30, Labette Health, we're going to host a town hall forum. We want to continue to hear from the community. So please, everyone that's here this evening, share it with your colleagues, your friends, your family. Please come back out in droves Monday evening here at 5:30. We want to continue to hear from you and see what's in the best interest of Independence, Kansas with health care. Anyway, thank you.
So I don't forget later, I do want to say one more time that we appreciate the United Methodist Health Ministry Fund and the Kansas Health Foundation who have helped to make this possible and who continue to be really responsive to health care needs in Kansas and particularly in rural Kansas. So Kim's in the room, but for all of those folks who aren't in the room too, I want to make sure we remember that. The Community Engagement Institute has the wonderful and challenging opportunity of often meeting in communities and in organizations when people recognize there's a gap and things aren't all that they want to be. So we're privileged to be a part of your conversation, and we also know that you're wrestling with some difficult things. We don't take that lightly. There is nothing scientific about some of what I've collected, but I've tried to listen and poke around, and I want to reflect to you some of the things we've heard in addition to the specifics of what's on all these flip charts that will get recorded. So one thing I heard was someone who was speaking and who said something like this: I choose to live in a community this size because I expect and I value relationships. And my concern is that in whatever is coming next in healthcare, these relationships are not available or they aren't going to help me. The internet is not a replacement for being able to ask my friends and my family about their experiences. And I'm less likely to have that moment of, I'm glad you're here, when I see a provider who's somebody from my church or my kids' soccer team. I heard somebody say something like, it may be actually easier to move to be near my adult children who help ensure that I get to all of my care needs than to stay in this community, even in nursing care. And navigating the system was already hard. Now navigating a system that seems newer and less familiar is even harder. I heard somebody say something like this: I wonder if people have died because they didn't get to care quickly enough, and I wonder if anybody is tracking data to find out if that happens. I heard somebody say something like this: being in an emergency situation is scary enough without having to wonder about where to go or if the care I receive will be adequate. And so access to emergency or urgent care 24 hours a day is really important to me. I heard people say there just aren't enough doctors. I heard quite a bit of conversation that's really compelling and part of what makes this difficult about how this is related to other challenges. So the challenge of transportation, which is a whole separate complicated thing, and the challenge of insurance, and the challenge of addressing poverty. I heard this distinction that there are technical needs related to access to health care, so things that I believe I should get, but there's also something that's more about a feeling I heard somebody say, we're already a ghost town almost, and this makes it worse. I heard somebody say, I really need providers to work better together and to communicate more. And in fact, I heard a lot about communication. I heard that we expect for our city and for other decision makers to let us know about steps taken, but also we want people to tell us what healthcare availability is here. So what do we have, and how do I find it and access it? There are some people who feel they have not been kept informed and in the loop as decisions have been made or considered. And in a couple of groups, they said the communication channels need to be broader. So the newspaper is one way to provide information, and it's important to look for other ways. I heard somebody say it's been 4 months since the closing date, and that's a long time to go without having more clarity about what's next. And so that feeling of being uncertain is really weighing on him. I heard this interesting tension. I heard several people say we really need to learn from other communities and their experiences, and we know we're not the only people who are facing this or who might be challenged in this way. And I also heard a couple of people say, we need to pay attention to our own needs and our own resources, and let's not bother about other communities. We need to look out for independence. I heard several people say that access to health care is an economic issue in a lot of ways, one of which is because it's important to employers who are here and to folks who might move businesses in or want to start businesses in this community. I heard a lot of people talking about how there's no one answer for what to do next, but there are a variety of approaches. And in some ways, that's exciting because this might be the opportunity to find new care models or opportunities or alternative ways of delivering care. There are research opportunities. There's a lot of potential now that comes in that uncertainty. And I heard some people say that part of what will make those partnerships possible is an increased awareness of legislation. So what are the state and federal opportunities to influence legislation that has to do with health care in general and access in general, but also legislation that might specifically be an advantage to independence as it pursues opportunities. I heard people say, you're all part of the mess because not everybody was using what was here. And people have a variety of stories for why those services weren't being used, but there's some sense that underutilization contributed to the current situation. It was really interesting, and my guess is this is what Amy and Judy and I will talk about in our van on the way home. We were led to believe that this was likely to be a fiery meeting. And I heard some people say, I'm angry. And I heard one people say specifically that phrase. But I didn't experience you all as being resistant to the conversation. So one of the things that might mean is that there are people who are angrier than you are who didn't come tonight. And I say that in a smart aleck way, but also as a cautionary note, like what voices aren't being included yet. But it also suggests to me, and I heard this specifically in one group, we're ready to move on and figure out what's next. And so I think there's a sense of that, at least in some places in the room. There's some really interesting questions about what role, if any, the municipality or even the county should play in making it more possible to access health care. I had one reaction to the group that met over here of healthcare providers, and that is that you all are a really complicated group. So I trust that a lot of good notes got taken, but I couldn't make any sense of most of what you were saying. And then one thing that I heard that I think might be a really important thing to end on, there was somebody in a group who said, I just want families in independence to have peace of mind. No decisions were made tonight. I imagine no decisions are going to be made in the immediate future, but I do appreciate the opportunity to play a role in helping you to keep this conversation going in, I hope, a productive way, and I hope that it gets you a step closer to this place of families and independence having peace of mind. Thank you for your commitment to your community and for your engagement tonight, and I know we'll be talking some more.